Good morning, everyone. Today we're going to show you how to do a patient alginate impression on both the maxillary and mandibular arches. First couple of things you're going to need to do are pre-adjust your headrest to make your patient comfortable and make it easy for them to sit into the chair and keep your light out of the way. So thanks for coming today. Come on in.
All right.
We'll go to the far side and I'll seat you from there. If you want to go ahead and have a seat, let's see if we can get your headrest as tall as you are. Okay. Go ahead and lean your head back a little. Do you have any support on the back of your neck? Does that feel good?
Yeah.
Okay, great. I'm going to go ahead and give you your armrest back too. Okay, great. I'm going to go ahead and get your bib on today. How's everything going?
Everything's going well.
All right. Okay, so I'll have you just lean your head forward a little bit. Everyone, you can notice that I'll put the bib tag on the opposite side so it makes it easy for me to see on the close side. And then our patient can go ahead and lean his head back again. Thank you so much. So the next thing that we're going to do is we're going to get all our PPE on. So I'm going to put on my glasses, I'm going to put on my mask, and always the gloves last, right? Gloves last so they don't touch anything else in the mouth. Are there any exostoses or tori? And we're also going to get a general idea of how large a tray we might try to use. So I'll please have you open and you can just relax all your musculature. You notice you'll want to tell your patient to do those things because when he tightens his musculature, I can't move his cheeks nearly as much or see. So patients often think they have to open wide. The goal actually is to have them stay relaxed and open fairly wide. So let's take a look through. When we look through, I don't see any tori and I don't see any exostoses on the mandibular arch. I also do not see any exostoses or palatal tori, or torus in this case, since there's probably going to only be one up there. And our goal is to check out to see how wide the arch is. I would guess from my experience that he will be using a medium arch on the lower and probably a large arch on the upper. If you try in the trays, which you should do next, you'll want to try in a tray that is the same size as what you think or smaller. You'll notice that there are mandibular trays that have a cutout in them for the tongue, and there are maxillary trays which protrude up into the palate. So that's the difference between the two trays, with the mandibular cutout and the maxillary palate. Let's go ahead and size the trays. You'll notice there are numbers on the handle which help you identify the size of the tray. Here we have a 1, a 5, and a 3. The 1 is a large, 3 a medium, and the 5 a small. There's no way small is going to work for him, so I'm going to leave that one down. If I really was careful about that and wanted to make sure I used the right size arch, I could try this in, but I'm going to go right for the granddaddy of them all because I figured that that's the correct size. When you look at the lower trays, we have a 2, a 4, and a 6 from left to right. The 4 stayed on the tray, that's why we work over a desk. This is a large, medium, and small, and I'm thinking that we're going to be able to use the medium with him. So our goal is to pre-try the trays in. So the first thing I'm going to do is I'm going to ask my patient to please face me. So that works very well. And you can lean your head back a little bit. I'm going to now have you open. You'll notice I have the tray in one hand and a free hand in the other. Trays do not fit straight in, okay? They're wider this way than they are this way. So the goal is to place the tray in sideways to the corner of the mouth, pull the lip slightly in the commissure area, and then seat the tray. Was that painful at all? Okay. Would this be easier? Okay. So our patient's telling us not to do it that way. As I place the tray in, I place it in as far as it'll go to the handle, rotate it in with a slight pull, and as I seat the tray, there are two things I do very carefully. Number one, the lip has to be over the front of the tray. Lots of people miss this and they miss their anterior teeth. The other thing we have our patient do is lift their tongue up through the middle and then have them set it back down and relax. Now, is that hurting you anywhere? What I'm now testing is for optimum bulk or uniform bulk. My goal is to have 4 to 6 millimeters in every direction. So I should be able to move it about a ½ an inch sideways and about a 1/4 of an inch forward and backward, or a ½ an inch total, anterior to the teeth, And that's how we're going to end up doing this. For a lower arch tray, once I get it seated, I'll have the patient bite down until they barely miss the tray. So I'll also line up this tray to somewhere on the patient's nose so I know exactly what direction to place this once it's full. These tips will help you make an excellent impression when you make that mandibular. So I'll have the patient practice. Please close down until you're just barely missing the tray. That's right, good. That's good right there. So now we're in a good position for the mandibular. Anything wrong with that tray? I'll please have you open. So we'll go ahead and remove that. You'll see it's also with a little twist. So we're going to use the medium tray. I'll set that one to the side. And the maxillary tray now, we'll try that one. Same idea. We're going to rotate the tray with the handle to the corner of the lip, rotate it in, pulling the lip aside. We'll insert the tray and we'll end up seating it. With the mandibular arch, what I didn't tell you was we seat the anterior teeth first and then seat the tray back as they lift their tongue up through. The maxillary tray goes exactly the opposite of that. We're going to slightly seat the posterior of the tray before the anterior. Otherwise, if we did the opposite way, the extra would flow down the throat and maybe choke the patient. We're obviously not interested in doing that. So let's try in this upper tray as well. You'll notice the patient's already pre-turned towards me. He knows the direction. I've put the tray in all the way to the edge. I slightly pull the lip. And now the goal is, you see how he's keeping his lip up? It's very important to have your patient say, just to relax their upper lip, so that when we seat it, we can get the upper lip over the front of the tray. Very key point. And as we seat this, we'll seat the posterior before the anterior. And we can see it's lined up very well with his nose. Is that hurting you anywhere? Okay, and we have a correct position. With the upper arch, you'll probably have your patient open a little more, and you're going to support the tray with two fingers, usually index finger and middle finger, going back, so you can support the tray from gravity pulling it off the teeth, allowing it to gel in the exact position. Remember to get the patient's front lip over that tray. I can't tell you how many times I've seen with a tight lip, could you please tighten your lip? See how it covers some of the CEJ area? If this is tight, the alginate cannot go up past the teeth into the vestibule. If it's relaxed, when I seat the tray up past, the alginate can then flow up high enough. Okay, once that's ready, we'll also take this out. And we're just about ready to go. So we've tried everything in. Our patient has been told what to do and is a good patient, so we can definitely get it done. Now let's go ahead and do it for real. So the next thing we're going to do is we're going to grab our alginate. The first thing you want to do is make sure the lid is tight, and you want to fluff the alginate. And when they mix the alginate and when they measure it, it's supposed to be airy. It's not supposed to be hard packed. So just flipping it a couple of times. When you open it and you look inside, you can see it's up to the top. It's not packed down to the bottom. And that is the correct way to measure the alginate. This is the provided scoop, so we'll go ahead and get a little more than we need. We'll just make sure it gets into that cup, and then we'll just knock the excess off. And we'll go ahead and put all of our alginate into some cups. And you can see I've pre-measured everything at 3 and 3. And we'll cover our alginate because it's moisture sensitive. Obviously, we don't want it to set with the moisture. We've pre-measured our water to 3. And we have 3 scoops of powder. Obviously, it's 1 scoop per increment of water. And now we're ready to go ahead and mix. Our patient's been prepared. They're ready to go. Always we use water prior to powder to eliminate some of the air bubbles. And then we'll go ahead and start. So all the powder is added in at once because it's pre-mixed. We'll use the tip of the spatula to end up just doing a little bit of wetting of the powder. And now we're going to use our alginate spatula in a figure-8 motion on the side of the bowl. And we're going to clean off our spatula. And we're going to smash it against the side of the bowl until there's a homogeneous mix. A couple of times around will work. And now that we've pushed it really thin against the side, we're popping little bubbles. You'll see little tiny bubble holes in there, and that's how we know it's homogeneous. So at this point, we can go all the way around the bowl, pick it up. We'll do the lower one first. It's a little easier for patients. You can see it's a little bit on the runny side. And we're going to fill up half of it at a time, pushing it into the tray and eliminating some of the excess posteriorly. Then I'm going to take some of the alginate onto a finger and I'm going to simply wipe it into the detail. So let's go to the patient's mouth. I'll have you turn towards me. And I'm going to place this finger, I'm going to put it right on top of the occlusal areas to capture all of the detail inside of those areas. And now I'm going to go ahead and seat my tray the exact same way. Line it up. I have the lip out in front. I'm going to start seating the front. I'll have my patient lift their tongue. And I seat from front to back. I'm going to have him now go ahead and start closing. And that's a good spot. And now I sit and I wait. So testing alginate, you're going to use a thumbnail and you're going to insert it, and you can see there's a little bit of an indentation that's formed, but it's rebounding almost all the way and fairly quickly. So your goal when you test your alginate is when you put your thumbnail in, my gosh, now even with that small amount of extra time, it's almost fully rebounded. At this point, I just wait another 15 or 20 seconds, and out here on my finger, it's cooler than inside the mouth. So our patient, probably the alginate's already set. So let's go ahead with a time lapse of about 1.5 minutes here, and let's go ahead and recapture our alginate impression from our patient. I'll please have you turn towards me again. You'll notice I'm going to get my finger towards the side of this tray. If it locks on, you can kind of use the sides and push up on the edge of the tray. But here I'll have my patient open, and I'm going to lift it with a snap, being careful of the opposing arch so I don't hit his teeth. And here you can see there are some areas that are a little bit thin, and in the anterior we are very thin. This is definitely an area where we would want to have more thickness, the problem being that we don't have the same amount of shrinkage with the alginate because the thickness is not the same. The first thing you should do is you should clean your patient up. I can't tell you how many times I've seen students stare at their impression for 5 minutes and their patient's trying to get all this junk off their face and wondering if they're ever going to get cleaned up. Students usually leave a little bit more material on a patient than what we have. Hopefully you'll be able to figure out how much to put in the tray in order to keep your patient at least decently clean. And still there's a little bit of stuff, but we're going to do one more. And I think he's comfortable at this point, are you?
Yes.
Okay, that's the most important. So let's go ahead and re-examine our impression. If you take a look at the actual detail inside the occlusal surfaces, you can actually see the bottom of the central groove has been captured. There are basically no other voids, and it looks like his third molars were extremely hard to catch because they're just partially erupted towards the back. Here we have most all of his third molar. And this tray, I wasn't sure we were going to get everything. If we can't, we'd extend the tray with a little bit of wax to help the material extrude back further in the mouth. But here I think we've done very well, with the exception of this canine, number 27, is probably going to have some inaccuracy. We also have all the CEJs present, posteriorly, lingually, and buccally. We have all those areas, and we have definitely some area past all those showing some of the bone as well. So this impression, other than this 27 area, is very, very usable. Cleanup is just as important. Cleanup can never be done in the sink. This stuff is set. If I try and put it down the sink, it's going to clog the sink and cause a big problem. So after it's set, you can see it sticks to the spatula. It becomes very easy to clean in one piece. Comes off very easily, and the same thing with the bowl, can be scraped clean, and all the large chunks can be taken right out. You can see it comes pretty much right out, just with a little scrape, and our goal is to get all the particulate matter into our trash can. Okay? So an appropriate amount of material to wash might be this much in a sink. So we'll do that off camera. So with the maxillary arch, we've already pre-mixed our alginate. We're going to fill it from the back of the tray forward dragging the material towards the front of the tray to cover it. Okay, so you'll notice very little air has been added into the mixture from the entry into the tray. So again, I'm going to grab some alginate to put it into the detail, and we're going to go ahead and go over to our patient. You'll notice that the alginate is not slumping off the back terribly. So my goal is not to create too much of an issue for our patient, so I'm going to wipe the back a little bit to make sure we don't go backwards. Now I'll have him open, and we'll reintroduce the alginate into the occlusal surfaces and a little bit of the mandibular, or excuse me, the linguals of the maxillary teeth. So at this point, we're going to go ahead and introduce our tray again, and I'm going to have him relax his lip. We'll go ahead and place it in the corner, turn it, and you'll notice the back of the tray is the first thing to see, and then the anterior of the tray. Now I'm going to have him lower his chin so that this material doesn't end up causing a problem in the throat. If you can see, his lip is very relaxed, and it's allowed all this extra alginate to come to the front of the mouth instead of down the throat. Could you imagine having this in the back of your throat while I sit here for 1.5 minutes? That's not really going to be fun for anyone. So you can see I'm making him smile because his lip is starting to get a little tighter, so I'll ask him to relax. And you'll notice I've changed positions to the posterior, where I can use a single finger on each side to support the tray during our alginate. You can see I've put a thumbnail in, and the line is still staying there. It's not quite rebounded very quickly. So we'll probably wait another 15 or 20 seconds, and we'll end up testing it once again. Our patient's doing okay? Excellent. So a verbal response like that, a yes or no, is always the best kind of question. Let's try with another mark to the right of the original mark. So you can see that is outside the mouth, and it's rebounding fairly quickly. And we'll do one more mark so that you guys can start seeing the difference between those. And that last mark is the quickest to rebound. It's probably the most complete rebound in the shortest amount of time. So you can tell it's actually doing quite well. Again, when we remove the tray, we'll have our patient open so we don't hit the opposite arch. You'll notice I've already sneaked my left hand up above the tray a little bit, and we'll remove it with a snap. A little bit of a click down and a forward motion. You have to not put too much pressure on the anterior teeth. So we remove it with a little snap. And let's clean up our patient. And a little bit on this lower lip, quite a bit actually, on the lower lip. So we can clean him up. Drag it away from all the facial hair. Makes it easier to clean up, not through. And since he's neatly trimmed, we don't want to create any more of a problem. Now following up with a dry one will probably work really well. So let's see what happened with our impression. Are you doing okay?
Yeah.
Perfect. So when you take a look at the impression, there's a little bit of extra that's fallen in here. Let's see if we can just tease that out before we look at it. So you can see the line of the lip is all the way across here. So I probably could have seated this a little bit further back into his mouth because the thickness here is a little large. But you can see I did a better job of capturing all the teeth without any issues being too thin. Where I have a thin area is in the palate near the nasopalatine nerve bundle. Around the clinic, you'll find this Pro Spray that is mixed to make sure it's fresh for you guys at the appropriate times. This will kind of preempt any infection control issues, and we're just going to simply spray these to do that. If you find a little bit of blood in your impression, you can either spray or initially, if you'll come by and turn the water on with your hand and use a little bit of indirect water on the impression and just rinse it out quickly, you can end up getting most of the bacteria and or blood out of your impression. Of course, you know from your lecture from Dr. Urdaneta that these will also imbibe water. So our goal is to spray these impressions, and then we can bag them up and take them across to HEC and get them poured up. So anyway, not too much in there after we're done. Just need them nice and moist. Last thing, we've used a headrest cover just to bag up our impressions to make them easier to bring over. Obviously, we want to limit the amount of moisture loss they have, or the syneresis. And of course, before you go, you should clean up your sink to make sure there's no alginate, so you're not going to create a problem with the sinks in our clinic. Okay, we've pre-measured our water and we've pre-measured our powder. So we have 28 milliliters of water, or close to 30. And always water in before our powder. And then we're going to place all of our powder in at the same time. Okay, so we'll add all of our powder in at the same time. We will have gone ahead and checked our impressions, which we already sprayed across the street. We're going to shake all the excess moisture. You'll hear it hit the bag. Okay, so we're ready to pour. I'm going to pour one of these correctly, and I'm going to pour one really incorrectly. Several different ways, so let's go ahead and try it now. So now that we have everything ready, we're going to go ahead and add our powder all at once. We're going to go ahead and wet this, and you guys will probably end up using our auto mixing bowls, okay? Auto mixing. Now you can see we've wet our gypsum initially, and we're going to go ahead and turn on our vibrating unit. Here you can adjust the amount of vibration as well. So we can go ahead and start vibrating the stone. I'll bring it forward so you guys can see a lot easier. And what we want is for the bubbles. So you want the stone to flow as we go through and have this move. So you can tell there's not a lot of bubbles because we added the water prior to the powder. And now with this mixed appropriately, we can go ahead and begin pouring. So what we want to do is add a small amount onto this, and there's three factors: the amount, the angulation, and the vibration. All those three have to work together in order for it to work. So you can see I have this lightly on the surface and it's vibrating. So the stone starts to move across the surface of the alginate slowly. Because this is a water-based material and this is a water-based material, they work together. So adding a small amount and having gravity with the angulation and the proper vibration move, you want enough vibration to make that move and get the bubbles to the surface. We always add from the same area over and over so that we end up creating a leading edge without any bubbles. You can see a bubble forming there. Can be teased away. And we continue to add until all of the detail is shown. So you can see now I'm angling it quite excessively so that we can get it around this bend. And then backward towards the new detail. So you can see it's creating a nice slow front that is moving over all the detail. And we can go ahead and continue to add so that we have all of our detail there. You can see now I've reached the end. There's a little bit of extra, so we can clean that up. And now we can add a little bit more at a time because all the detail in the anatomy has been covered. So at this point we've created something that's a little bit taller than what we need. And our goal is to create a stress-free setting environment. So our goal will be to end up just having it sit without any pressure on the alginate or on the gypsum. Okay? So for instance, a solid base area without any interruption. We'll let that set for 45 minutes before we end up separating it with this stone. So let's make some mistakes. If you keep it flat and you don't add enough stone, it doesn't do anything. When you increase the vibration, you see it move, but now I don't have enough tilt. So you can add too much vibration and cause a problem too. So we're going to tone it down, probably to about there, which is just around medium. Okay. Now let's add too much material all at once. You see how it traps the air underneath? There's going to be big bubbles that come up because I've trapped a lot of air underneath. See one bubble here, Another bubble there. 2 more bubbles in the back corner. So when you go too fast and too steep, you're going to trap air. Okay, so I'll increase the vibration and try and get those bubbles up and try and thin out the material so that we get some bubbles. See these big bubbles that are forming? So we have to let that air out. That's what that vibration is going to do. So too little doesn't move material-wise. Too much can trap, especially when you go too fast. Too little vibration doesn't move, and too much can cause more porosity by shaking this too much and creating a kind of a shaky feel to this. You can see there's a lot of area that's overshaken. But if you end up toning it down a little bit, you still see it moves, but we don't have that rough look to the surface, so we know it's an even amount of material. So that's how to pour incorrectly and how to fix it. We're going to show you how to make a quick base. Once we've done this, we're going to take the water out of the mixture by using a paper towel. So I'm simply going to dump it right onto the center of a towel, and I'm going to want to try and form this in a size that's going to create a base. So what we'll do is we're going to take the water out by just blotting it. While this is wet and while the surface of this is glossy and wet, now you can add a base on there. I'm going to try and make it a little bit smaller so I don't have so much to trim later. If you make it too messy, you're not going to have a chance to form it. So hopefully we don't get a lot of misjunction between these areas, so you can tease it up a little bit so that you don't have holes in your cast. You can see I left a lot of work for myself to do back here on this corner. And you really don't want to do that until there's been an initial set that's been lost. So we'll turn this around. You can see we have a little bit more work to do in the front, but if you remember the cast, this cast was set back in the mouth, so I'm probably going to have to trim all this off. So instead of waiting till later, pardon me for reaching in front, we're going to just cut it off. Works a little better if you wait just a little longer. But you can see I can neaten up the cast quite a bit without me even having to cut through it when it's hardened later. So now we've got all that. You see all the water's been taken out and some of the color of that stone has been put into this as well. We'll have a much more sizable cast without any extra covering the tray. That's what our goal is, so we don't have a tough time removing it later. This particular impression was poured, and you can see I've trapped the tray in the anterior. Now that we've lost our gloss and it's been setting for a couple of minutes, my goal is to unbury the tray so that I can actually remove the cast. So we might chip pieces off. You'll notice that I'm still on the tray side because I don't want to break the entire cast. If you do this too early, you'll ruin your entire cast. Here it's just about right because it's taking a little bit of effort to get past. And if I could just barely see the edge of the tray or come very close to it, then I know I'm going to be able to separate it later. Here you can see I've damaged this because I didn't wait long enough. Hopefully we didn't have any detail in here like a retromolar pad that's extremely important for removable partial dentures. But you can see with a little bit of haste, this will ruin a cast. Better to have added it and cleaned it off when it was super wet than to do it at this stage. But you can see that's easy to break since it's so skinny. So you can tell at 5 minutes you can't separate this just yet.